speaking about injuries in the Caribbean Premier League of cricket, not so much as an audit, as to discuss some emerging trends that we're seeing and seeing if that's shared across all the countries. The CPL was set up in 2013. At that time, it was the second largest international T20 franchise league after the IPL that had just started before that. And we had 6 teams, one of which has changed hands and islands. But the team ownership has changed dramatically over the times. And many of the teams now are owned by owners who own teams in many countries and bigger leagues. And therefore, the trend has changed quite a bit, which is what I wanted to discuss with you. The CPL, I think this is the right thing here, right? No, that's not it. Is that it? Okay, I don't think the pointer is working. It's not to worry. No, you're changing the slide. Okay, don't worry, not to worry. The CPL is held across 3 continents, North America, South America, and Jamaica, as well as many other smaller islands. So we have matches in the United States of America, we have matches down in Ghana, which is in South America, and a whole string of islands along the side. Each country, by the way, is a separate country, independent, its own currency, its own visa requirements, etc., etc. So even though the West Indies is considered to be one, we're actually 17 different countries. The medical structure consists of a chief medical officer, but we'd have local medical teams at each venue, which would make sure that they'd take care of all the needs of the people in that particular country. We changed that subsequently to have what we call traveling medical officers to ensure that standards were maintained. And now we actually have 2 officers who go to all the matches, all the venues, because we want to ensure that there's a certain level of standard in sports medicine care. So, in the beginning, our very first incident was quite interesting because we had never seen this thing called chikungunya, which I know in India has been around for years. Chikungunya, as you know, started in 1954 in Tanzania. But it hit the Caribbean in a massive way. And the very first injury that we had was somebody who caught chikungunya, got very weak, fainted in the bathroom and hit his head against the sink. And that was the very first injury of CPL. We then had an Australian cricketer who came for the CPL, flew in on the Tuesday from Australia, went to his first net session on Wednesday, broke his ulna and caught a flight back home on Thursday. We had a spectator who was electrocuted when there was lightning and an electric line went down and the fellow walked in water which had a live line in it and he was electrocuted. And then we had a chap who, in all the flying between the islands, developed seizures and was hospitalized and had seizures in hospital, and then we ended up having to take him back to his country as well. So it started in quite a dramatic way with non-cricketing injuries, so to speak. So over the 10 years, we've had 169 injuries and 53 illnesses that have been reported. And you'll notice that every year there, the injuries superseded the illnesses except 2020. And I'll get to 2020 a bit later because that was our bubble year, when COVID came in and everybody was contained within a vicinity, and suddenly we saw a lot more illnesses than we saw injuries. I just put this up to point out that the injuries and illnesses across the teams was more or less uniform, except one team which reported more than others, and one team which reported far fewer. But by and large, they're similar both in injuries and illnesses. So of the 169 injuries, the vast majority, as you would expect, were in all-rounders. 95 of these injuries were first-time injuries, but of course, as you can see, a lot of the players, just about every role had injuries. What I haven't captured here is what they're actually doing. So even if a fast bowler got an injury, it didn't mean he got it while bowling. Might have had it while fielding or batting, but that's a deficiency. As predicted, or predictably, the thigh, which is quadriceps and hamstrings, it's separated in the graph, but if you put them together, it consisted of the most injuries. And then the wrists and hands and the back. In fact, as T20 cricket progressed, you'd see more and more of these injuries taking place where people are just trying to smash the ball, and the bowler in this case ended up having surgery because of a finger injury. So as I pointed out, all-rounders had the highest number of injuries, and amongst the all-rounders, thigh injuries, back injuries, and wrist-hand injuries were the most. But the graph here basically gives an idea of different body parts that were affected. You can see the knee there, you can see the hamstrings, quadriceps separately, and wrist and hand. And I keep saying that because there's going to be some significance to it as we go along. Just looking at the thigh injuries, I put this up because of interest is not the fact that we had thigh injuries. Obviously, you're going to have quadriceps and hamstrings. But of interest was that only one player was out for more than 21 days. Only one player lost, or sorry, 4 players lost between 1 and 2 weeks. That's 8 to 14 days, 5 players that is. And most of the hamstring injuries either didn't have any lost time or they were 1 to 7 days, which is counterintuitive to what I normally practice and how I normally see injuries, especially in track athletes and so on, where it takes much longer for them to recover. But interestingly, even in test cricketers and first-class cricketers, I find they take far longer to recover from these injuries than they're doing in the franchises. Fast bowlers, once again, apart from 2 knee injuries which required surgery, you're seeing that most of the fast bowling injuries, including the back ones, recovered very, very quickly, which is a bit of an interesting point as well. And then this is not meant for consumption, but just to point out that most of the injuries had no time lost. And when we remove that no time lost area, you'll once again see represented that most of the injuries, irrespective of who the person was, only lost between 1 to 7 days. And those that lost longer were because of illnesses sometimes. Concussion was interesting because we had 10 head knocks, but only 4 concussions, 2 of which were while fielding. Pre-protocol days, only 1 day was lost due to concussion. Once concussion protocols came into place, most people recovered between 5 to 7 days. But it's interesting because even with concussions, players either did not want to come off and show that they were okay, or would get hit pretty badly and would have to be stretchered off and wanted to return to play the next day. So it took a bit of time for people to understand what was going on with concussion protocols and so on, and the players reacted in different ways as well. And then, of course, when treating players, you always have those who look like they're next to death's door, and within 2 minutes you see them running up and down because they don't want to come off the field and lose their place in the next game. There are decisions that one has to make, and I'm just deviating a wee bit. There are decisions that you've got to make sometimes. I play this clip because if you look at Baz McCallum at the non-striker's end, you can see him hobbling there. And I'm putting this more for the practitioners because he had serious back issues, and he was literally throwing away his wicket. And I had to send down a message asking if he wants to have something for pain, and you can see I am asking permission from the opposing captain. And so we came in and gave him a jab, which was just for fast-acting pain relief. Now, I say that because it was something that we had to initiate from the medical team. He was willing to just give away his wicket, and that would have cost the team some points. Well, having administered the injection around the ring, you'd want to think that you're pretty safe. He's running pretty well there. But sure enough, there are cameras everywhere, and at that break, they're zooming in to see exactly what this is and what was given. And worse still, trying to give medical advice on what actually was done. But that's not the point. The point is that decision-making has to be taken into consideration. Firstly, can the player get through the tournament? What are the least amount of matches that are missed? And you have to take long-term complications into consideration. And what we're finding is that the team physios are taking decisions into their own hands. But now they're being heavily influenced by owners of franchises who will order medical tests, who will order treatment modalities, who will try to preserve them for the next league. And you've got to stand up to that. There's a vast amount of over-investigation with ultrasound and MRI. In fact, the art of clinical diagnosis is almost disappearing. And that's because the head team, the owners are saying, well, you must get this done, you must do this test, you must do this test without even seeing the player or understanding what the injury is. So in the future, and I'm not finished yet, long-term effects of decisions made. You've got to take future tours into consideration. And in the past, those future tours used to be international tours. I'm finding more and more that players now are asking about the next league. Will I be fit in time for this international league or that international league? They're not worried about international cricket. They want to preserve themselves for the leagues. And lastly, when dealing with injuries, the idiom of do no harm always must be adhered to. So there's the science of cricket and there's the art of cricket, but whatever you do no harm. So I'm going to spend the last 5 minutes and 40 seconds on the illnesses that we've got, because we had some interesting illnesses. In the USA, we had a guy who got viral meningitis, ending up in the hospital. That kept him out for a while. We had a lot of GI complaints, but none of them were too violent, and not many had days lost. And we even had a bubble-related psychological problem that had to be dealt with as well. But by and large, as you can see there, the illnesses were things like problems with headaches and things to their face, the neurological I mentioned already, ENT and respiratory, which weren't too bad, a CV thing. We had a renal calculus that we had to deal with, and the other run-of-the-mill stuff. Time lost from illness. Majority were no time lost, and only one person, the person with the seizure, was taken out of the competition. And our viral meningitis was right at the end of the competition, and he lost, I think it was 7 days or so. COVID-19 was interesting because we were the first international league to resume in any sport. So the first bubble that put up by Nick Pearce and his team in England that we were part of was the first return to sports, but we were the first international league to come in. And what we had was what I call a water and glove bubble as opposed to a contained bubble. So the bubble in England was contained. The players, everybody's within one vicinity. You trained there, you played there, you lived there, everything was contained. Water and glove was where we stayed at a hotel, but then you'd go to a ground, you'd come back, you'd go and practice and you'd come back, and everything was contained, but it was like water in a glove. You'd actually go to different points and come back. We had, interestingly, less injuries, but more illnesses, and that was perhaps because I was stuck in the bottle for 6 weeks, so they'd come to me with every single illness they had, and we were also able to detect the injuries much better. But it was not supposed to be a long bubble. If you see in Trinidad and Tobago where we had the bubble, there was very few cases until CPL came along. And suddenly there was a rise, and we had to keep ourselves in the bubble. But that was 220 people coming from 18 countries in every continent. So it was quite a mix of people that we brought in, and later on we can talk about the mechanisms of bringing them in. 3 were actually tested positive before they even came, so we had to exclude them and those that were even suspected were excluded because the borders of Trinidad and Tobago were shut. They had to do special flights to bring the players in. While we were in the bubble, there was a second surge, which meant that we had to lock down even harder. And so we spent 6 weeks in the bubble. And that led to some psychological problems, that led to a lot of other problems, social problems on the players themselves. Subsequently, all the West Indies bubbles were held on beachside resorts where people were not only enclosed in a bubble, but they're kept on the beaches so they could have a bit more activity to take place in. Lastly, I'm just going to point out that in the CPL, we've had some surgeries. Lacerations and of the hand and wrist were obviously the most common. We had dental issues, lacerations to the eye, knee problems in the lower limb, and even a uretary calculus that we had to remove and get the player to come back within 3 days. So, by and large, not many surgeries, but during the bubble time, it was actually quite interesting how we had to bring them back. So, to end, there has to be a global approach to illnesses with communication with treating medics. There's a lot of imposition that I'm finding amongst the franchises, which is leading to the loss of the science of medicine. We're finding that the sort of head doctors of these franchises are calling saying, well, do this MRI, do that. I had a chap in the last CPL who had a hamstring injury. Took him off, looked after him, and I decided that the next afternoon I was going to do an MRI for prognostication because it was that time of the competition. The owner called and told me that he's going to have the MRI done that evening, right after the match. And I said, no, you're not. And then the physio came and said, well, why don't we do an MRI tonight and we do one tomorrow? I said, because it makes absolutely no sense. And his answer was, well, in such and such league overseas, that's what we do. And I said, well, you can take the player and go to that league. But we're not doing it here. It just makes no clinical sense. But this reliance on MRI has got the players now thinking that if you don't do an MRI, you can't treat them properly. There's a tendency of players to protect themselves for franchise cricket, as I mentioned before. And I'm noticing that there's a lot of pushing to get players through that particular competition without much thought about long-term complications, long-terms out of cricket. So they'll get themselves through the competition, but then you find that they're missing for international tours because now they're recovering from the injury. And as I said, there's a tendency of owners to protect their players for franchises. So I have another minute and 7 seconds. Should I sing a song or can I stop here? Thank you.